Advanced care planning and advanced healthcare directives are often topics that, frankly, Americans tend to avoid. They avoid them because thinking even about the possibility of serious injury, serious illness, let alone the reality of death. In fact, many Americans believe that if we never talk about bad things, they won't happen to us. While it would be nice if that was the case, it unfortunately isn't. And that's why understanding exactly what advanced care planning and advanced healthcare directives are is so critical for all of us. Personally, I like to think about advanced care planning as a conversation with yourself, with your family, and with your doctor. It's an opportunity to discuss your values, your wishes about your future, your healthcare goals, and how all that translates into actual healthcare decisions. An advanced healthcare directive is in fact a legal form which outlines specific instructions that are intended to direct your medical care if you find yourself in a position where you are unable to express your healthcare decisions. Anyone over the age of 18 can and should fill out an advanced healthcare directive regardless of your current health status. In other words, you can be an incredibly healthy 18-year-old on your way to start college or an incredibly unhealthy 98-year-old. Both of them have the legal right to make their own personal healthcare decisions and to control what happens to their body. And only recently have we been granted that right. Prior to the 1980s, advanced healthcare directives frankly didn't really exist, unless, of course, a patient had a truly fatal terminal illness. Major changes in patient rights and advanced care planning were brought about mostly by the tragedies of the AIDS epidemic that hit during the 1980s and the 1990s. It was a unique and horrible time in our history. At that time, as you recall, young, healthy Americans were suddenly suffering and dying from a new and frightening infectious disease, and it was being aired all over the media, and all of us in the public saw it. It was during this AIDS epidemic that living wills were developed to allow young, dying patients the right to name their own powers of attorney, to speak for them if they became unable to do so for themselves. And then there was the case of Nancy Cruzan. Nancy Cruzan was a very healthy 24-year-old woman who sadly got into a terrible car accident in rural Missouri in the early 1980s. Sadly, she fell into a coma and never woke up. Nancy remained unresponsive for more than 7 years, but was kept alive in a hospital in Missouri. She, of course, did not have a durable power of attorney for health care, and of course had no living will, because why would she? She was only 24 years old, and she was incredibly healthy. Now, after attempting to medically reverse her vegetative state for over 6 years, Nancy's family realized it was hopeless, and their beautiful daughter would never recover. They then asked the hospital where she was to stop her life support and allow her to peacefully pass away. However, both the hospital and the state of Missouri declined this ask. Ultimately, the case of Nancy Cruzan went to the courts. First, it went to the district court level, and there the state of Missouri won, and her life support was continued. Then it was heard at the Missouri Supreme Court level. There again, the state of Missouri won its case, and Nancy remained hooked up to maximum life support. Finally, it went all the way to the United States Supreme Court. At the time, it was the only end-of-life case ever heard by the United States Supreme Court. Interestingly, at the end of the case, both sides actually felt that they won the case. a remarkable achievement. First, the state of Missouri. The state of Missouri felt they won the case because the U.S. Supreme Court allowed all 50 states independently to set their own rules about life-sustaining treatment for patients who cannot speak for themselves. However, there was a caveat. If the patient filled out an advance directive, that document would become the gold standard, and it would be accepted as clear and convincing evidence in all of our 50 states. Nancy's family, along with patient rights advocate, also felt they won the case. The Supreme Court declared several new clinical rights. First, all patients 18 years and older can accept or refuse any treatment at any time at any hospital in the United States, regardless of their health status being either completely healthy or very sick. Second, all patients, again, 18 years and older, can continue this right to accept or refuse any treatment, even if they lose their ability to speak for themselves. But to fully maintain this right, they must complete an advanced healthcare directive before they become incapacitated, which is something which we are all doing today. Third, the Supreme Court also ruled that there was no legal difference between withholding or withdrawing any life support. What does that mean? It means that just because a treatment was started, it does not mean it must be continued indefinitely. Machines have no rights, patients have rights. And finally, the Supreme Court said that nutrition and hydration, in other words, food and fluids, are no different than any other type of medical treatments. What does this mean? It means that nutrition and hydration can be stopped or frankly never started at the patient's or the surrogate's discretion. In the end, that case of Nancy Cruzan was brought to the United States Congress, where it went on to pass the Patient Self-Determination Act of 1990, which went into effect throughout the entire United States on December 1st, 1991. This is important. This new law says that all patients entering any hospital or any large healthcare facility or large medical group must be offered the right to fill out an advanced healthcare directive. This is also the law that the Cruzan family and patient right advocates fought so hard for, so that each of us today could be empowered to make our choices about our own bodies heard. This is freedom and liberty at its finest, and everyone over the age of 18 should assert this right to tell hospitals and doctors what kind of medical care they do or they do not want to receive.